Hello, Dr. Gallagher. I'm a plastic and reconstructive surgeon, and in this video I'm going to talk about drain-free abdominoplasty. So this concept is a little bit retro because it has been around for many years, and years ago two very clever surgeons, Pollock and Pollock, came up with a way that patients could skip drains. So first of all, what are drains? Drains, in my fashion, are a little bit dated, and it's very rare in my practice I use them. But basically what it involves is if we remove something from the body and we're worried that the body is going to produce fluid in that space which is left behind, oftentimes a small tube, drainage tube with usually a bulb on the end is placed in there, usually for a week or two, and that is your drainage tube. Now, of course, the better way in my mind of dealing with that dead space is to quilt down that dead space, place many internal sutures so that there is no space, and that way you will not get a fluid collection. And previously I've published on it in top surgery, for example. It also significantly decreases bleeding in that space. So for that reason, it's my personal bias that it's better to do things drain-free and it's more comfortable for the patient. And as such, most of the procedures I offer in my practice are certainly drain-free. And that would be my gender affirmation procedures as well as my body contouring procedures, such as brachioplasty, which is reduction of the excess arm skin and tissue, as well as thighplasty, and of course, like this patient inquired about, abdominoplasty. So it is very safe to do this procedure without a drain, and in fact I published on this with some surgeons in Indiana a few years back, and what we looked at, in fact we pushed the envelope on this, and we looked at patients who had undergone bariatric surgery or obese patients, or patients who'd lost 100 pounds before, to see even in those big reductions where a lot of tissue and fat is coming off, is it safe to provide this without a drain? And what we found was yes, it certainly is. So it's a more established concept. I guess there are still surgeons out there still placing drains. This may be because they're not familiar with that progressive tension or quilting surgery technique, or maybe it's a little bit faster. In my hands, adding in that extra few sutures to close down that dead space only really adds usually a few minutes, so it tends not to take that long. But certainly a drain-free procedure is a very safe thing to do. If in a rare circumstance a patient does get a fluid collection in their abdomen, oftentimes it's something we can deal with very quick and easily in the office, and pain-free as well. But the very worst case scenario, if that fluid collection was to persist, the patient may need to get a drain. And well, that just means they're kind of back to the patient who already got the drain in the first place. But that in my hands is very unusual. So I hope this kind of clears up the confusion, and drain-free, in my opinion, is definitely the way to go.